So Johan, you are a world famous researcher who has done a lot of studies on what's causing bedwetting. Can you tell me what are the main causes of being a bedwetter?
Well, over the past decade, it has been become obvious that the majority of children with enuresis have or an increased urine production overnight, what's bigger than their bladder, or that they have too small for age bladder volume, so lower than their diuresis. So it's a mismatch between those two factors.
Yeah. So it's the amount of urine versus the ability to hold the urine. Yeah.
Yes.
Do we know anything about what's more important than the others, or are they similarly important?
Well, I think that about 1 on 3, 1 on 4 have a normal bladder volume for age and have an increased amount of urine that they are producing overnight, where in the majority of patients we are dealing with too small for age bladder, what often also is obvious because those children have to go very quickly to the toilet, are losing little drops.
Yeah.
But there's a group who has both symptoms also.
Yeah, you could actually have both of them.
Yeah.
Does this mean that the treatments that we usually prescribe for bedwetting, do they influence these factors, the small bladder and the amount of urine produced?
Yeah, there are 2 treatments who are, and medicine likes then to talk about evidence-based medicine that are really proven. So patients who are producing too much urine have a clear benefit of a drug, desmopressin, that decreases the amount of urine. And if the urine is decreasing overnight and it can fit within the bladder, they are coming dry. The children with a small bladder, of course, there's not too much urine, then desmopressin will not work. But there it's very clearly proven that treatment with the alarm therapy not only makes the children dry, but also might increase the bladder volume so that they are not relapsing afterwards.
Yeah. Does this mean that it is an advantage to know these factors before you start treatment for the condition?
That's a difficult question. I think it depends on where you are starting. If you say, if I want to start for the burden of my child, I want to have maximal response rate because he will be frustrated if he's not responding, then it's very clearly you have to do full screening, including questionnaire, including a diary. We are very well aware that parents, but also some doctors say, oh, for the first attempt, that's too big burden to do the work. And then you can say, we do one of those 2 therapies. And if you are failing, well, that you are then doing the screening. I think both options are defendable.
Okay. Thank you very much.
Thank you.